Next, I would like to invite Dr. R.P. MAURYA. He is Associate Professor and in charge of Ocular Trauma and Oculoplasty Unit, Regional Institute of Ophthalmology, BHU. He is PhD in Ocular Traumatology, Editor-in-Chief of International Journal of Clinical and Experimental Ophthalmology. He is the recipient of APAO Award 2021, and recently he has been given the responsibility of Joint Secretary of Ocular Trauma Society of India. He will be talking on don't miss ocular injury in polytrauma cases. We welcome you, sir.
Good morning, chairperson and audience. Thank you, Dr. Meghna, giving the opportunity to share my experiences about the ocular injury in polytrauma. I have no financial disclosure. Written and informed consent for use of photographs and investigation reports were obtained from each patient. Some terminology we have mug up, that is injury, the harmful event that arises from the release of a specific form of energy, maybe mechanical energy, thermal energy. Trauma is a Greek word that means a serious body injury or shock. Any injury or wound to the living tissue caused by a stringent agent, that is traumatic agent, called trauma. Trauma may be isolated, that is injury limited to one body system, or maybe multiple or polytrauma, that is injury involving two or more than two body parts. Never confuse with the polytrauma and major trauma. Major trauma is any injury that can potentially lead to serious outcome or blindness. The trauma is a global pandemic. It is second most costly disease, and trauma survival, particularly polytrauma survival, is time dependent. Trauma cases are increasing day by day due to rapid urbanization, industrialization, competitiveness, and fast, busy life of individual. Trauma constitutes significant impact on the individuals, their lifestyle, their family, society in terms of the morbidity, medical cost, and diminished quality of life, loss of service or productivity. Polytrauma have both primary life-threatening injuries need high priority, need immediate intervention, and along with the secondary injuries, that is non-life-threatening injuries of low priority, where referral can be delayed. Like ocular injury is a serious secondary injury in case of polytrauma. The causes of death in polytrauma, there is immediate cause of the death that occurs within second to minute after injury, mainly due to the brain injury or vascular system injury. Medical treatment can rarely improve outcome of such immediate death. Only prevention can be done. While the early death, which occurs few minutes to hour, that is called golden hour, when we can save the life of patient, is mainly due to airway obstruction and major abdominal head injury, or maybe due to hypovolemic shock. The late death usually occur after a day or weeks due to septicemia, thrombosis, and multi-organ failure. The common causes of polytrauma reported is the road traffic accident, rail accident, fall from height, assault-related injuries, and communal riots or terrorism, and also natural disasters like earthquake, cyclone, landslides. And polytrauma can also be seen in industrial accidents. 1.2 million people die all over the world because of road traffic accident, and India accounts as high as 7% of the total RTA. RTA is the 9th most common cause of death amongst all disease worldwide. WHO anticipated that up to 2020 it will be third commonest cause. And once we see the mortality rate due to road traffic accident in US is 5 to 10 per 1,000 vehicle accident, while in our country it is higher, 70 to 80 per 1,000 vehicle. India, there is one accident per minute and one death every 3 minutes. The management of polytrauma is again challenging and difficult. The principle of management is, because the polytrauma always associated with life-threatening injuries, time essence. And there is a need of organized emergency service team. The management is a pre-hospital management. That is, if the serious injury and one can scoop and run, or if it is, one can manage at early stage, start the resuscitate patient or primary treatment, and then hospital care. That is primary survey and resuscitation. Transportation is very important. The airway, breathing, circulation should be checked during transportation and before departure of the transportation. Sometimes we get the polytrauma in mass casualty patient. Then there is a overload on the service, primary health hospital care. The triage is very important. Triage is just sorting of the patient based on need of the treatment and available resources to provide the management. Ocular injury in the polytrauma victim, most of the eye injuries are mechanical in nature, but non-mechanical injury due to thermal, electrical, chemical burn, firearm, or explosive can also cause polytrauma. The victims are mainly young adults between 30 to 40 years of age, and polytrauma patients in particular have a cumulative risk factor for sight-threatening injuries. The commonest polytrauma associated with eye injuries are cranioorbital trauma or maxillofacial trauma. The pattern of ocular injury in polytrauma, which is reported in literature, are the orbital fracture, periocular contusion and laceration, open globe injury, intraocular hemorrhage, posterior segment injury like optic nerve injury, retinal injury, and intraocular or intraorbital foreign bodies. There is a diagnostic challenge of the ocular injury in polytrauma patient. The identification of injury is challenging because sometimes undetected or missed globe injury, which are not uncommon because of difficulty in examination due to periorbital swelling, and sometimes radiological imaging may not detect such injury, globe injury. The visual acuity cannot be assessed in unconscious or paralyzed patient in polytrauma patient. Now, this ocular assessment of the ocular injury, after once the patient is stabilized and vitals are normal, then we can go for a detailed history to determine the mode and circumstances of injury. Examination of the patient, that is inspection, abnormal position of the globe, facial asymmetry, malocclusion of the teeth, and jaw movement to see the associated facial injury. And palpate point of the tenderness, any bony fracture, any discontinuity in orbital rim, and crepitus, surgical emphysema, that is again a serious emergency. And then go for the special investigation like vision assessment, relative apparent papillary defect assessment, and extraocular movement tonometry if there is no open globe injury, and detailed fundus examination. Here is a patient of road traffic accident-related orbito-facial trauma showing multiple displaced fracture involving the floor and lateral wall. Another case due to fall from height, that is having orbito-maxillofacial trauma. This was a patient got a multiple trauma, cranio-orbito-facial trauma due to physical assault, blunt trauma. And CT scan again showing multiple comminuted displaced fracture, that is pan-orbital wall fracture, which was managed by putting the titanium mini plate, and patient's vision and cosmetic reconstruction was done. Then polytrauma due to mobile blast. This was a 10-year-old boy playing with an old mobile along with the charging. He got amputation of the fingers along with the open globe injury with multiple foreign body and with vitreous hemorrhage and posterior retinal detachment, which was managed with conjointly with the posterior segment surgeon. This was another interesting case of craniofacial trauma due to bear attack. You can see there is a multiple bony displaced fracture with loss of globe along with the laceration of the scalp and facial periocular skin, which was managed with the help of plastic surgeon and maxillofacial surgeon. The polytrauma due to gunshot injury, this young girl having assault with the gun because of robbery and showing multiple corneal foreign body and also the pellets in shoulder. Another assault-related cranio-orbital trauma with retained large intraorbital foreign body during Naxalite attack, and metallic arrow was removed with combined orbital and cranial approach. Another case of perforating injury by gunshot showing double perforation because of assault. So how to prevent the polytrauma? Major cause of polytrauma is road traffic accident. So we can prevent or minimize the road traffic accident. Need to educate common people about the RTA and accident and about the first aid and resuscitation. Strict implementation of traffic rule to avoid overtaking the traffic and encourage the use of appropriate safety glass and helmet by motorcyclists, and also to use the seat belt, use of airbag equipped car, which can minimize 30% of the mortality in road traffic accident. While driving, always avoid some activities like drowsiness or sleepiness, and even if you are fatigued, don't drive. So avoid also fast driving in night and overloading. While driving, again, never drink, never eat, and never use the mobile while driving. While drinking, also never use intoxication, smoking, or alcohol while driving or prior driving. And another cause is the assault. So try to avoid the interpersonal conflict, resolve it as early as possible, and take extra precaution, particularly during communal riots or any natural disaster. So take-home message is polytrauma patient may have life and vision-threatening injuries. All polytrauma patients should be examined by ophthalmologist even if there is no visible ophthalmic injury to rule out the occult posterior segment ocular trauma. While evaluating ocular trauma patient, ophthalmologist should always assess whole patient in toto, because life-threatening ocular injury, non-ocular injury may be there. So if there is a ocular trauma, again, evaluate patient in whole, and if you are having polytrauma, never miss the ocular examination. Early referral and intervention is the key step to save the life as well as sight. Thank you.